So we're looking at arthroscopic lysis of adhesion, and this is a surgical procedure. We'll talk about what it is and reasons why you might actually need to do it. So first, I would like to explain to you guys what is adhesions from my own point of understanding. Adhesions is like abnormal connection between, you have one structure in the body here, another one here. So you're having this abnormal connection, and the thing is kind of like, will I say, like skin growing across, not really skin, meat growing across, muscles, right? But very weak. It's like cobwebs. Yes. So there's a way you can just put this, an arthroscope, basically. And when you're talking about arthroscope, you're basically talking about the joint. It could be any joint, but most of the times is the shoulder joint or the knee joint. You understand? So this, instead of cutting the person open, you're using this small place to just cut it. So this is how it looks like weak muscles growing across where they are not supposed to be growing. That's adhesions. So it's actually a minimal invasive surgical technique. It's used to treat joint stiffness. That's arthrofibrosis. Yes. The best way of defining this was like fibers growing across where they're not supposed to be. So most commonly it's used in the knee. So you have had a knee injury. It can also be done to the shoulder and any other joint. So you use an arthroscope to visualize and carefully remove the scar tissue. Can you see how they are explaining it better now? Don't laugh at my definition or explanation at the time. It was trying to tell you guys from the basic language, So arthroscopic lysis of adhesions is the removal of fibrous scar tissue inside the joint, and you use the arthroscopic instrument. Purpose is to improve mobility and relieve any pain when conservative treatments have not worked. So you have tried to use physical therapy, you have tried to manipulate under anesthesia, you have tried to use drugs, they have not worked. You're now going for this one. So it's commonly done at the knee, can also be done at the shoulder, can also be done at the elbow joint. So indications. You use it when there's a post-traumatic arthrofibrosis. Like after a fracture or ligament injuries, you're now having some abnormal growths across compartments, Post-surgical stiffness. So maybe they have done a surgery for you. After the surgery, you're now having these complications. Failed conservative treatment, mostly when they have tried to stretch, physiotherapies, manipulate and all of that, and it has not worked, Procedure, you should know that it's done under anesthesia. They do small incision and they put the arthroscope inside, So the arthroscope is inserted into this joint to visualize the adhesions. So specialized instruments will now cut and remove the scar tissue. The joint is mobilized intraoperatively to access improved motion, and is often combined with manipulation under the anesthesia so that you have maximum results.